guys, welcome back to my channel. So for this video, I wanted to discuss some of the most common misconceptions regarding feeding tubes. So yeah, this is going to be an educational video. I did a lot of research on it so that I can bring you guys facts. All right, let's get down to it. Number one, and I think this is the most common one. So people believe that only three groups of people require feeding tubes, and that's terminally ill patients, premature babies, and the elderly. While it's true that probably these three groups are the most common to require tube feedings, but they're not the only people. Um, there is a whole lot of young people out there who require feeding tubes for different reasons. You do not have to be in the ICU or going through chemo to require a feeding tube. A feeding tube is basically just is needed when you are unable to consume enough calories to sustain your body. And there could be a whole lot of different reasons for that. It could be that you mechanically cannot swallow food and there's no way for the food to get into your stomach and to your intestines. Then you would require a feeding tube into your stomach. It could be that your stomach doesn't work. Maybe your stomach is paralyzed, as is the case with gastroparesis patients. And that means while you are fully capable of chewing and swallowing the food, but the food doesn't, your stomach doesn't digest the food. It just sits there for hours and hours until you vomit it back up. But then it might be that your stomach is just fine and you are unable to absorb the nutrients on your small intestine. So you can eat, you can swallow, everything is fine. You can eat as much as you want, but you're just not absorbing enough of the calories that you are putting into your body. So it really, it doesn't matter if you keep eating, as long as you are not absorbing the food, you are never going to get the calorie requirements that you need to sustain your body. Then you would need a feeding tube. And there are groups, and then there are other groups of people where they have different illnesses of the digestive system, as is the case with Crohn's disease. If the small bowel is so diseased that it's not absorbing your nutrients, then obviously that person will need a feeding tube. If a person has a mechanical issue with their digestive system, as is the case with small bowel dysmotility, chronic intestinal pseudoobstruction, yeah, these are whole different types of motility disorders where if you eat, you get a whole lot of difficult symptoms to deal with. You would find that if you eat, you are in severe pain. Eating can cause obstructions. Eating causes vomiting. It causes severe pain. It causes distension. And you might find that the symptoms are so bad, the person is simply not able to cope. And in that case, they do require a feeding tube. So while a person can eat, but the question is, should they eat? If eating is causing them that much misery and is causing them such severe symptoms that they land them in the hospital, you know? Okay, enough with that rant. So yes, myth number one, no, it is not true that only premature babies, the chronically ill patients and elderly people require feeding tubes. Completely untrue. All right, number two, you have to be in hospital or inpatient for you to have a tube, meaning that you require round the clock care if you have a feeding tube. And obviously this isn't true. You go to the hospital, you get your feeding tube, and you can go home and resume your normal life. you would need to check in with your nurse or your doctor. But no, you do not. Getting a feeding tube doesn't mean that you have to stay in hospital. And then the third one is that there's only one type of food that can be used for a feeding tube, which is those specialized formula like the one I use. And that's simply untrue. There are people who have feeding tubes who still eat your normal real food. They just blend it up. So they will take whatever people are having for supper, maybe, and then they'll add maybe water or stock or milk, and they'll just blend it up and give it through the tube. And again, that's something that's entirely dependent on the patient. It's dependent on what their issues are, why they require the feeding tube, how are they able to process the food that's been given to them. Because with me, I've tried three different types of formulas, and the one that worked for me was Peptazorb and Peptamine. But Peptamine was really expensive, and Peptazorb is very similar to the Peptamine, and I'm able to tolerate that. But the the other types, the more thicker formula, the more nutrient dense formulas, I don't do so well with them. I did try the Nutritia. Uh, I don't remember what it's called. I will insert a picture right here. Um, and then the fourth misconception is that getting a feeding tube will affect your physical activity. Um, with this one, I have to say that I don't think it is necessarily true. Um, and here's why. Getting a feeding tube doesn't disadvantage you physically in any way. Anything that you were able to do before you got your feeding tube, you will most likely still be able to do after you get your feeding tube. It just depends on how debilitating your illness is. If when you got your feeding tube you were already unable to do much physically, then probably you still won't be able to do that much after the feeding tube. But in my experience, I found that getting my feeding tube actually enabled me to do more physically, because I'm not in as much pain. I'm not vomiting all the time. I'm not so distended that I can't even bend. So for me personally, getting a feeding tube actually helped with my physical activity. However, there are days where I have a lot of tube pain, and that does limit what I can do for those specific days because of the pain. All right. And then, okay, this one is a little bit upsetting. And that's, there are people who believe that you're not trying hard enough to eat. Why do you need a feeding tube if you are physically able to swallow? And this is a very dangerous statement to say to someone. Um, Nobody in their right mind, no healthy individual in their right mind would want to go and have a hole surgically drilled into their stomach and a tube, a foreign object pushed into you, which sometimes can come with complications, bleeding. I've experienced bleeding, granuloma tissue. It's not an accessory. You get a feeding tube. You don't decide to get a feeding tube. You get a feeding tube. That decision is made between you and a doctor, a medical profession. No doctor would give you a feeding tube if you do not need one. Okay. So, no, it is not true that people who have feeding tubes simply just didn't try enough to eat. We do try. I mean, who in their right mind would give up food? It's okay. Even people with eating disorders who end up getting feeding tube, it's still an illness. It's a mental illness. It's something they're not in control of. There's something just not chemically right in their minds. So, if they don't get the feeding tube, they might end up dying. So I don't think it's right to stigmatize people with feeding tubes to make them feel like they're any less of a person. All right. Um, the next one is that feeding tubes are forever. Okay. This is also very much dependent on the person. Um, but majority of people who get feeding tubes, they don't they do come off of them if they get better eventually. Obviously, premature babies, majority of them, they are weaned off their feeding tubes. Terminally ill patients, like cancer patients, if they go into remission and fully recover, they might not uh, they might not need their feeding tubes anymore. People with digestive illnesses, they might they might get better. Their illnesses might get better, and they are then able to tolerate the food, and then they will no longer need the feeding tube. I myself hope that eventually I will get my feeding tube taken off. Um, Feeding tubes complicate life. Uh, this one, I suppose it depends on how you look at it. Um, Yes, feeding tubes will add a degree of complexity to your life. It won't things won't be as easy as they were while you were able to eat like a normal person. There is a lot of financial aspect of having a feeding tube, needing monthly supplies for your feeding tube. Traveling with a feeding tube is it's not easy. Uh, yeah, it does add a little bit of complexity, but I wouldn't say that it has complicated my life. Personally, I would say it's just added a little bit more work into it, but the benefits definitely outweigh the bad. Next one is, if you have a feeding tube, you cannot eat by mouth. Again, this is not true. A lot of people who have feeding tubes are still able to eat normal food with their mouth every day. It depends on the person, what their illness is. Somebody who, for example, suffers from severe gastroparesis may not be able to eat by mouth because every time they eat, they vomit. Someone with chronic intestinal pseudo-obstruction, for example, may not even be allowed to put anything into their mouths because it just is so dangerous for them to eat. I, for me personally, I physically can eat, but eating causes very severe symptoms. Um, so I prefer not to eat, at least not to swallow the food. I can chew the food and then spit it just to curb my hunger and cravings. Things that I am able to eat normally are popsicles. I can drink like a drinking yogurt here and there. I will sometimes still get symptoms with stuff like yogurt. but popsicles, I can enjoy that. I don't get too much pain from it. I can still drink all sorts of juices. Yeah. This one, I'm adding the next one just because it's something that I believed. It might not be what most people believe, but I believed that getting a feeding tube would essentially cure me, which unfortunately it didn't. And this is something that my doctor did warn me about, that getting a feeding tube was not a magic fix for what I suffer from. It did help reduce um, the symptoms that were related with eating, such as the severe distension with every meal, severe pain with every meal, vomiting after almost every meal. So it definitely helped in that regard. However, I still experience pain daily, so that hasn't changed. The severity of my pain is definitely better now that I don't have to eat solid food to survive. Um, so, yes, I would say that the tube definitely improved my quality of life, but it did not cure me. All right, and then the next misconception is that if you have a feeding tube, you do not get hungry. Couldn't be further from the truth. Having a feeding tube does not stop your body from getting hungry. You unless you no longer have hunger cues, which then I don't know. Maybe it's a positive thing, but I don't know. I don't think it is. Um, when Especially when I'm around people who are eating and I can smell the food, my mouth starts salivating. I get hungry. It's very difficult to watch people eating while you are not eating. That's why I started chewing the food but then not swallowing it. So I would chew the food and spit it out. Um, and yeah, this is something that I haven't actually spoken about because I'm a little bit ashamed of it. But as a person, you have to do what you need to do to survive. You do what you do to try and make yourself happy. You find different coping mechanism to make your life bearable. And if chewing food and spitting the food out is what's bearable for me, then that's what I'm gonna do. um but yes, definitely, I get hungry, I get cravings. The only time that I don't get hungry is when I'm in very, very bad pain, like severe pain. Then no, I won't have an appetite, I won't be hungry, I won't even want to look at food. But on a more manageable day, I will have at least one meal, um, which I don't swallow. Yes. The next one is that getting is that a feeding tube doesn't hurt beyond the initial healing stage. That's also what I thought. Unfortunately, that is not true. You After surgery, obviously you will be in a lot of pain, surgical pain, and once that heals, your tube will be it won't be as painful as when you got the surgery. However, you will still experience pain every now and again. It might not be daily, but you will experience pain on your tube site. And the reason for this is you have applies to those with surgical tubes. So you essentially have a hole on your stomach. It's a wound, and your body is constantly trying to close it. However, it can't close it because there's this foreign thing that's preventing the body from closing it. And what the body ends up doing sometimes is it overproduces tissue while trying to close this wound. And that process is called granulation. and the tissue that gets produced, which is called granuloma tissue, it ends up building up around the the stoma, the the tube opening. That's called the stoma. And this granuloma tissue, it can itch, it can hurt, it causes a lot of irritation, and it can bleed, and it can actually cause a lot of bleeding. I've experienced it. It is not fun. um, yeah, I actually really freaked out the first time I saw it. I couldn't understand why I was getting it. I believed that I was doing everything right. I was very diligent in cleaning my stoma, keeping it clean, making sure it's taped in place, and yet I still got the granuloma. And I even now, um, every couple of weeks, I do get granuloma tissue. And then there's obviously accidentally yanking the tube, that causes it to hurt as well. The next one is that some people believe that when you have a feeding tube, it functions like your your normal. I'm not sure how to put this. There are people who believe that having a feeding tube means you use your tube as you would use your mouth, meaning that you have 3 meals a day through your tube. This is not necessarily false. There are people who are able to give what's called bolus feedings, at regular meal times, 3 or maybe 5 times a day. And basically, what that means is you get a high volume of feed within a specific time. So maybe let's say in an hour you are going to get maybe 500 milliliters of your feed, or maybe 300 milliliters of your feed, and you're going to do that at specific times of the day. So maybe it might be at 8 o'clock, and then 1 o'clock, and then 5 o'clock, and then 10 o'clock at night, and then you are done for the day, which is great because I think for those people, it's probably life is still a little bit more normal. But then there's also a group of people who are unable to tolerate bolus feeds. What that means is the bolus feeding can cause a lot of discomfort, like pain. It can cause vomiting. It can even cause dumping syndrome, which means that the food leaves the stomach too fast if it's being given at a high volume, and that can cause very unpleasant symptoms, such as dizziness, fainting, vomiting. Yeah, it's not a good situation. So if a person is incapable of bolus feeding, then they have to do what's called continuous feeding, and that means that they have to stay connected to their feeds for hours on end. It can even be 24 hours, it can be 20 hours, it can be overnight. It's entirely dependent on the person. This one might get me in trouble, but yeah, I will include it. And that is, medical professionals know a lot about feeding tubes. Unfortunately, I have personally found this to not be the case. I've come across quite a few medical nursing staff who didn't really know what to do with my tube. I've had nursing staff clog my tube and not know how to unclog it. Yeah, I've had a dentist actually ask me, what is that? Like, why do you need that? What is it? And it's something that's not very common. So just because a person works in the medical field, it doesn't necessarily mean that they've come across a feeding tube before. Feeding tubes are not that common, from what I've seen. I've personally never met anyone with a feeding tube. I've only met people through the internet. I've never physically met anyone else with a feeding tube. So, yeah. Mm, yeah, I think that is gonna be it for this video. I just wanted to bring a little bit more awareness around this feeding tube topic. I hope you guys enjoyed the video. I know I enjoyed making it. I do know I got a little bit heated on some of the questions, just because this is very personal to me. So yes, I really hope you all enjoyed the video. Please comment down below if you want to know anything else I might have failed to answer in this video. Yes, all right. So if you did enjoy this video, please give it a thumbs up. If you haven't already subscribed, please be a dear and just press the subscribe button. Thank you very much. All right.